The next speaker is Dr. Ziva Cooper, who's the director of the UCLA Center for Cannabis and Cannabinoids. She's a professor here at UCLA. She is an expert on the therapeutic potential and adverse effects of cannabis and cannabinoids. She studies, it's very interesting, the potential for cannabis constituents to reduce reliance on opioids, differences between men and women in their response to the pain-relieving effects of cannabis as a function of age, and therapeutic effects of cannabinoids in patient populations. Really looking forward to her talk here today. I can't think of anyone better to give the talk than Ziva Cooper. Warm welcome to Ziva.
So it's an honor to be here. Thank you for that wonderful period of mindfulness. And it was very apropos. I was telling my husband last night, I've been fortunate to give hundreds of talks to different audiences. And I've never been, I think, more honored and also more nervous to speak to this community. My husband was diagnosed with brain cancer about 1.5 years ago. Ironically, I was writing a grant to study cannabis in cancer patients during that same period with Patty Gans, who's an unbelievable human being. And it really put things in perspective. So thank you so much for inviting me to speak to this community and for giving me an opportunity to learn from you. And so the talk I'm going to be giving today is a little bit different than the type of talk I usually give. I usually talk about data, which I'll talk a little bit about today, about the adverse effects of cannabis and things that you really should watch out for. And I'll be talking about that today as well. But I also appreciate that I'm speaking to a patient community here and taking that into account and giving some real life good suggestions and guidelines, keeping in mind that I am not a clinician, I am not a physician, and I am not giving you clinical guidance on how to use cannabis and cannabinoids, but I'll be sharing with you what the research and evidence says, hopefully in a way that you can use this knowledge to the best of your capabilities. So thank you so much for having me. So this is our map of the United States. In 2025, there are 38 states that have legalized cannabis for medical use. When I talk about cannabis here, I'm talking about the cannabis plant with a certain amount of THC. THC is that primary psychoactive and intoxicating component of the cannabis plant. 24 of these states have moved on to legalize cannabis not just for medical use, but also for adult use, so recreational use. And so in those states, as you can see in the green, those states are ones that have multiple dispensaries and increased access to people, not just people who are using for medical purposes. And then we also have an additional 9 states that have legalized cannabis of that lower strength variety. So it only leaves about 3 states that don't have any cannabis availability to people. Okay, so this has really shifted things dramatically. Cannabis is federally illegal. So even though it's legal in the majority of the United States, it's federally illegal, and that has implications for patients going over state lines. Right? You can imagine the implications of that. It has implications for me doing my research. And it also has implications given the fact that there's no unifying body that's helping to regulate these products. So the FDA, the Food and Drug Administration, oversees the quality assurance of food, of drugs, of supplements. We don't have that in the United States. And so each state is really left to regulate these products, which has become difficult, and also to regulate the economy or the marketplace around this. And so that has developed an interesting industry that is state-specific. Each state has different laws and different products. But one thing that's unifying across these states is that all of the states that have legal cannabis for medical purposes include symptoms related to cancer and cancer treatments as being potential where you can get cannabis for medicine. So here we'll talk today about what cannabis is, We'll talk about how and why it's used, specifically in cancer populations. Is it helpful or harmful, and what to know as patients? So first, what is cannabis? So those of you who have heard me speak before probably know a little bit about this. Cannabis has 140 or more unique constituents. These are called phytocannabinoids. For short, we call them cannabinoids. Delta-9 THC, or THC for short, is that primary psychoactive and intoxicating component. When we hear about the negative effects of cannabis, it's usually because of this one molecule that's been studied for decades upon decades. We know that cannabis is intoxicating because of this molecule. We know that it could have cognitive impairing effects because of this molecule. We know that people like to use cannabis. It feels good for them because of THC. We also know that when people use it repeatedly, daily, at high doses, people can become physiologically dependent, and I'll talk a little bit about that in a bit. However, like a lot of other medicines and drugs that have therapeutic effects, there are also negative effects. So THC does have therapeutic effects. It was FDA approved back in the 1980s to help improve appetite and nausea, specifically in cancer-related populations. In some countries, it's approved to reduce pain, which is also relevant to cancer populations. So that's THC. Cannabidiol, CBD, is another phytocannabinoid that has garnered a lot of attention over the last decade. In part, it's garnered a lot of attention because, unlike THC, it is not intoxicating. Unlike THC, you can take large amounts of CBD. When I say large amounts, I mean you get that 5 milligram capsule from the dispensary, you can take 2,400 milligrams of it and not really feel a cognitive effect, not feel intoxicated at all. When you take those high doses repeatedly every single day, you do not develop a dependence. There isn't withdrawal. And there was a lot of evidence in animal literature suggesting that it might be helpful for a range of conditions. And so it became really popular and interesting to people who are compelled to use cannabis as a potential therapeutic. And in fact, in 2018, the FDA approved CBD for certain seizure disorders. People take CBD to help with anxiety, to help reduce pain, and a lot of other indications. So here are a couple of indications here. There are actually over 700 indications for which people think cannabis might be helpful for. We know for THC, it's helpful for increasing appetite, reducing nausea. Maybe it's helpful for reducing pain, chronic pain, neuropathy. It's helpful for sleep in certain patient populations. People think it might be helpful for reducing anxiety in certain doses, opioid withdrawal, and then we have CBD. CBD is thought to be helpful for a range of indications, but as of now, we know for sure that it is helpful for certain seizure disorders. The other indications are kind of up in the air. There are many other phytocannabinoids, and those of you who have been in dispensaries in California know that a lot of products have these other phytocannabinoids available. So here are just a couple: CBDV, CBG, CBN, and we are studying in our lab, actually, CBG as a potential cannabinoid that might be helpful in improving appetite, reducing nausea, and also reducing pain. And CBG is thought to not have that intoxicating effects like THC. So some emerging trends that we've seen with this booming industry, the first is, and actually I talked to somebody during the break today who told me he experienced this firsthand, is that cannabis has become a lot stronger over the last several decades. And so this is a figure which depicts the strength of cannabis as determined by percent THC on the y-axis across years. And here what we see is cannabis that has been seized by the Drug Enforcement Administration. So this is unregulated, what some people call black market cannabis. And you can see that over the years, the percent THC in cannabis increased dramatically. If you follow this out even further, in 2017, THC percent increased up to 17%. Now, some of you who have been to dispensaries recently might say, 17%, you can't find cannabis that has that little THC in dispensaries today. And that's true. When you look at regulated markets, so for example, this is in Washington State, and you go to those dispensaries, and what you can see in the green is the frequency of products with that amount of Delta-9 THC. Generally speaking, it is quite difficult to find cannabis with less than 20% THC. And now there are also concentrates, so concentrated products where the THC is extracted from the cannabis plant. And those concentrates, which can be inhaled or taken orally, they can be up to 100% THC. So we know that the strength of cannabis has increased markedly over time. And for some people, for some patients who've used cannabis in the 70s or the 80s and now just coming back to it today, might be quite surprised when they take that first puff of the cannabis cigarette. Modes of use have changed dramatically. You walk into dispensaries and all of a sudden, it's no longer cannabis cigarettes. You can get a wide variety of oral products. You can vaporize cannabis. So vaporizing cannabis means that warm air is passed through the cannabis plant and is not combusted, and then you inhale the THC. And the thought is that it reduces respiratory risks because you don't have those combusted toxins. And then you also have the concentrates. Rick Simpson oil is one that is familiar to the cancer community, which can be 70% to 100% THC. And Dab's Wax Shatter, which is more familiar with the recreational community, which also is almost 100% THC that can be inhaled. We have CBD all over the place. You go onto overstock.com and you can find your CBD-infused pillowcase that promises a restful night's sleep. CBD-infused athletic wear that promises good relaxation and muscle, promoting muscle health after your workout. CBD-infused hummus. You go to Erewhon, you can get a shot of CBD in your smoothie for a mere, $16 on top of the $32 smoothie. And then you can get your tinctures. Now, despite the fact that these products haven't been tested, up to 30% of US adults are using CBD on a yearly basis. We also have those other products with those other cannabinoids, CBN, CBG, CBXYZ. You can get it as a topical, a vape pen, a capsule. Now the question is, what are the effects of these products? Are they safe? Before even asking if they're therapeutic for the reason why people are taking them, are they actually safe? And the truth is that we don't know. We don't know in part because they're very hard to study, they're federally illegal, so they're hard to bring into our campus and onto our lab, right? But it's also hard because you have an emerging industry, it's hard to keep up with it. When we look at cancer patients across the United States, this was a big study with 14,000 patients across the United States, and it was found that 33% of cancer patients were using cannabis. In pancreatic cancer patients, 40% were using cannabis at the time. And how are they using it? You could see differences across the landscape if a state had legal products or illegal products. And we see here that in states with legal cannabis products, the majority of cancer patients are using oral products or edible products, beverages, capsules, tinctures. In illegal markets, the majority of people are smoking it. They're still smoking it, maybe because that's just what's available and that's what's easiest to use. So does this matter? Is method of use important? And this was also a topic of discussion earlier today during the break. So here I want to show a depiction of what it looks like and why method of use is important. If a patient is considering using either inhaled form, whether it's vaporized or smoked, or an oral product, what can one person expect? And so here, this is adapted from one of our studies over 10 years ago. It's hard to believe. But when you look at, let's say, pain relief, the differences in how quickly you can feel that pain relief and how long that pain relief lasts varies considerably between inhaled and oral use. And so here, when you could see over time from 0 to 6 hours, 360 minutes, immediately after somebody inhales a product, they will feel pain relief, but it will quickly come back down to baseline, which means in order to achieve pain relief, one would have to use it again soon after. For oral use, you see a delayed onset of pain relief, but it's more sustained. Okay, so one would think, all right, if you want sustained pain relief, maybe oral products are the way to go. And if you look at, let's say, a negative effect, and let's talk about intoxication as being a negative effect. Now, it might not necessarily be a negative effect if intoxication makes you feel good and you're feeling really lousy, and that intoxication helps you to eat and helps you to move around and function, okay? But just intoxication, what we see here is that mode of use matters as well. You smoke, you inhale, you get intoxicated from 0 to 100, 100 being maximally intoxicated, 0 to being no intoxication at all. You inhale, you get intoxicated very quickly, and it comes down to baseline. When you use oral products, you don't necessarily get as intoxicated, but it lasts a longer time. Now, for some people who don't realize that you have to take time for the oral product to take effect, that person might take more of the oral product, which might lead to more intoxication. Some of you might remember this editorial from 2014 in the New York Times by Maureen Dowd. So at the time, I thought she was very brave in reporting her experience. She was in Colorado. Colorado had just legalized cannabis for recreational use earlier that year. And she talked about her experience, what it was like in a hotel room, eating a candy bar that she had gotten from the legal market. And Maureen made the mistake that a lot of people make. She had a whole candy bar, she ate one square, no effect. She ate another one, no effect, and soon she ate the whole candy bar, which had 10 servings in it, and for 8 hours she couldn't move. Okay? And what's interesting is that this was 2014, people still report after having these experiences, having this type of effect. This is what happened in Canada. Canada has federally legal cannabis. It legalized in 2018, but it didn't legalize edible use until 2020. What they found was over time, with the increased legal market, there was an increase in emergency department visits of older patients who were using edible products who were showing up. Because again, think about it. When you use an oral product, it has a long duration of effect, which could be good if it's increasing your appetite or reducing pain. But if you're intoxicated and you're confused and you're uncomfortable, that's going to last a long time. And so this is an example in Canada, and we're seeing this in the United States as well, where there are increasing number of visits because people are using edibles in a way where they don't understand how to take it. So cannabis among cancer patients in the United States. Why do people use it? And we've heard these are the symptoms that people have issues with the most: sleeping, pain, stress, anxiety, depression, recreation. Recreation can be good, okay? Appetite, digestive issues, neuropathy, fatigue, and a cure from cancer. These patients that were surveyed, again, this was 5,000 out of 14,000, did they find relief from their cannabis use? Yes. Almost 60% reported that they felt an improvement in those effects. Now, one thing you might be asking is, what were they taking? And that's a good question. What were participants taking? What were respondents taking? And how much? What was the dose? What was the cannabinoid? And they were reporting it themselves, what their effects were. What does the literature say when you look at clinical studies where you compare a placebo to a cannabis or a cannabinoid product? Does the literature suggest that cannabis might be helpful for these indications? So if you look at the literature, and these are findings, I was on a committee through the National Academies of Sciences in 2017 and 2024, and we summarized the strength of the evidence for cannabis to be helpful or harmful. And what we found was that there are indications that cannabis or cannabinoids, those chemicals in the cannabis plant, they might be helpful for sleeping, they might be helpful for pain, anxiety. They're clearly used recreationally. 50% of Los Angeles is using cannabis recreationally right now. It's helpful for appetite, helpful for reducing nausea, and helpful for neuropathy. But note that it's not cannabis as a whole. Cannabis is a complex plant. There are specific cannabinoids in here. And so the question is as a cancer patient or as a clinician, when thinking about using cannabis for some of these issues, what is the dose? What's the method of use? And what is the cannabinoid? These are 3 critical questions. Okay, so let's talk about relevant risks and considerations. Intoxication, we already talked about how intoxication is an obvious effect of cannabis, and whether or not this is a risk or maybe even a benefit to certain patient populations should be considered. In part, because of this intoxication, when people use cannabis with THC, not CBD, with THC, people can experience impaired memory, attention, learning, impaired psychomotor effects, which can lead to fall risks, which can lead to impaired driving. We know that there are associations between cannabis use and negative mental health implications. For example, cannabis use is associated with depression, with anxiety, with suicidal ideation. But we also know that people who have depression and anxiety use cannabis, and they sometimes report that they use it because it helps them with their depression and anxiety. So it's hard to know which way those associations go. We know that cannabis use at high doses frequently can lead to something called cannabis use disorder. So this is using despite interference. And the reason why I want to call this up is because of the dependence that might occur with people who are using frequently. You'll notice that with dependence, and again, with many different types of drugs, people develop physiological dependence. And if they stop or if they skip a dose, they experience withdrawal. So cannabis dependence, if somebody uses frequently and they stop using abruptly, the frequent withdrawal symptoms are increased anxiety, irritability, physical symptoms, feeling like the flu, stomach aches, potentially increased severity and pain, reductions in sleep, and reductions in appetite. So you can see that the withdrawal symptoms are mirror images of the reasons why people actually use cannabis. And so for somebody who's using cannabis, not knowing that dependence or withdrawal symptoms can occur can lead to not understanding why they're feeling a certain way, especially if somebody's going in for surgery. Let's say if people are using cannabis daily before surgery and they're inpatient for a while without their cannabis, these withdrawal symptoms can really impact recovery, or at least we hypothesize, we think it can impact recovery. We know that there are certain drug-drug interactions with cannabinoids, especially with orally administered cannabinoids. And so this is a QR code that is a good resource that links to certain drug-drug interactions. We know that there's a lack of product integrity. And this is shown multiple times, even on regulated markets, where the question is, when you look at the bottle that you're buying, can you be assured that the label is accurate? And so this is from a study that looked at CBD products, cannabidiol products of pills, and they found that 70% of these products were mislabeled, and the consumer who thought they were just buying cannabidiol, 20% of these products had THC, measurable amounts of THC that could have clinical impact. And also, regulation can only go so far. So last June, there was an expose in the LA Times. And what they did was they analyzed a lot of cannabis products in the regulated dispensaries in California, in Los Angeles. And what they found were high levels of pesticides in these products. Now, California, I think I've always said that California is kind of a gold standard across the states for testing of cannabis products. We've been doing it for a long time. They have very high standards. And yet, the regulations hadn't changed since 2018. And so pesticides that were not around in 2018 were now found in these products. And what happened was this led to the Department of Cannabis Control in the state of California to kind of crack down a little bit and make sure that these products were adhering to certain regulations. And so now they have on their website, the California Department of Cannabis Control, they have a website where you can go to find which dispensaries are regulated, which is important because only 20% of dispensaries in California are actually regulated, actually sell products that adhere to California standards. And they also have a website where you can look at recalled products. And I just looked yesterday at their recalled products. And just yesterday, the first 6 items had been recalled over the last 2 days. So they are constantly updating this page, and they explain why they've been recalled. And so you can follow this QR code. If you or a family member are using cannabis products and you are interested in knowing if your cannabis product does have contaminants in it, you can be kept up to date with the Department of Cannabis Control website. Consumer knowledge. So maybe half of the room here might have more consumer knowledge than I do. But for those who don't, knowing what these products are, knowing what you're buying is extraordinarily important. And so this is something called a certificate of analysis. And all products from regulated dispensaries should have a QR code that links to a certificate of analysis. And that certificate of analysis will tell you what are the ingredients in that cannabis product, what are the percents, and also how many doses are in that product, something that Maureen Dowd might have benefited from before she ate that candy bar. The Department of Cannabis Control in California just put together this brochure. And they are requiring all dispensaries to give out this brochure, but only to new customers, which is a real shame, because this brochure has extraordinary information in it. It talks about what the difference is between CBD and THC. You are all experts in this now. It gives you a sample of cannabis effects. It tells the consumer to start low. If you're going to use THC, start with a very low dose, 1 milligram, 2.5 milligrams. If you're smoking cannabis, use a plant product that is what's called CBD dominant, mostly CBD, not THC. Go slow. If it's your first time and you're inhaling, take one puff and wait a long period of time before taking that other one or before that second piece of chocolate. It also talks about how to dose THC. And so this brochure is actually quite useful. So patient considerations distilled. I gave you a lot of information here. You know that there are novel products on the market. Effects are going to vary considerably. Cannabis is not one thing. Effects are going to vary according to dose, method of use, cannabinoid. These products are illegal. There's no federal oversight. So keeping up with these products in your state is really important. And also, you should always be mindful about going on planes with their products or crossing borders with your products. It's still federally illegal. State-regulated products offer more protection than those that aren't. There is therapeutic benefit associated with cannabis products, with these cannabinoids, and a lot of the therapeutic benefit targets a lot of the issues that cancer patients are faced with. But there are adverse effects that you should be mindful of. Also, in general, those new products on the market, there are unknowns, general unknowns, and we're working hard at UCLA to be able to study them, but we are not able to keep up with the entrepreneurial spirit of California. So talk to your physician, and I think one thing I learned here, and I actually changed my slides this morning, is that it's important for all of us to continue learning, me as a researcher, clinicians, from the patients, to hear what people are taking, what's helpful, what's not helpful, and to not be scared about having that conversation and about that dialogue. It's important to seek regulated products if you are going to use cannabis, and also to implement ways to reduce risks. And so if you'd like to learn more, please feel free to follow us on our website. And I'd also like to really call out, as was called out before, the NIH. All the data here, except for maybe the pesticides in the California market, is because of NIH-funded research, which is in serious jeopardy right now. We are extremely grateful to the NIH for continuing their support, and we hope that we'll be able to continue doing this. And lastly, thank you for the Hirshberg Foundation for supporting our work from the very beginning until now, and for giving my lab and our family an opportunity to actually get up and move. This was from the 5K run a couple of years ago. You can see my husband there with his little short shorts, and my kids and the lab. Thank you so much.
Professor Cooper, thank you so much. And I wanted to, I had a patient recently who was using cannabis products for nausea. He was getting chemotherapy. It was very bad, and he actually was, because of the nausea, having issues tolerating his therapy. Long story short, it came down to cannabinoid hyperemesis. I wonder if you could just talk about that just briefly, kind of touch on it and kind of how that can really be impactful for care.
Yes. So would you like me to step down? Oh, okay. Okay. So this is what's interesting. Thank you so much for raising this point. I just put up on the slides a couple of most relevant risks. One risk that we did not see coming at all before the cannabis industry started was something called cannabinoid hyperemesis syndrome. A ironic or paradoxical syndrome where people who use cannabis for long periods of time with high amounts will develop a syndrome of extreme painful gastrointestinal distress that is accompanied with severe vomiting. And this is paradoxical because THC is known to help improve appetite and reduce nausea. But something physiologically is happening, and we have a grant under review. Well, it was supposed to be reviewed last month, which got, all the reviews stopped, but it will be reviewed in April, to understand why this happens to certain populations and what can be some of the therapeutics that we can use for it. Right now, it's probably underdiagnosed in states that don't have legal cannabis laws. But in California, if you talk to NED physicians who work here at UCLA, they'll tell you on a nightly basis they have people in there who are in severe painful distress because of this vomiting. So we don't know how it's going to interact yet with cancer patients who are using cannabinoids for nausea and vomiting, but it is something definitely to be considered and to watch for. Thank you.
One question online is 80% of California dispensaries have products which are not cleared by the California Department of Cannabis Control. How are they allowed to remain open? That's the first question.
You can ask the Department of Cannabis Control. I know, but I just want to say that's an astounding number, and that's true, that 80% of the dispensaries are not regulated, and so consumers don't know that. So as a consumer, to be vigilant to make sure that the dispensaries you go to are registered.
Are regulated dispensaries, do they have like a sign on the door the way that a restaurant that gets an A grade would have?
They do. I think that they do have their license.
Right.
But keep in mind that the unregulated dispensaries are very good at presenting like they are regulated.
Gotcha. Another question is, what dose is a high dose of THC?
So this is also a good question. What dose is a high dose of THC? Now, if I were to quiz you guys, if this were one of our classes, I would say, what does this depend on? The method of use, right? Are you inhaling it? Are you using it orally? Are you using it topically? Also, it depends on who the person is and how experienced they are. So for somebody who has not used cannabis in 30 years, or for somebody who's never used cannabis, and they're about to use a product that's oral, like a pill or a tincture, I would suggest going as far down as 1 milligram THC. And that's super low, and sometimes what you'll have to do is you'll have to find a product that's actually a CBD product with that low amount of THC, rather than a THC product. And so I would recommend starting off as low as 1 milligram. Now, some patients are using very high amounts of THC every day, and they've built up to that level. They develop tolerance to the adverse effects. And so 1 milligram in that population and those people who are using every day would not really have any impact at all. And if you're smoking or if you're inhaling, again, using the lowest strength you can find possible. And so I would probably say 2% THC, and that would require getting a cannabis plant that is mostly CBD with that low amount. And that's actually, we study those low doses as well as the high doses in the lab, and 2% THC cannabis gets people intoxicated. Yeah. Thank you. Thank you so much.
Thank you so much. Great talk. Really so incredible to lead it off with so much emotion. Thank you so much.